These conversations bring together innovative leaders from different industries to share their expertise and vision about the world we live in and the technologies that drive it. So let me start by thanking our sponsor for today, AmeriHealth Caritas. They're a medical assistance managed health plan serving more than 193,000 recipients across PA, headquartered in Harrisburg, Pennsylvania. So AmeriHealth Caritas offers all of the benefits and services of a regular medical assistance, plus special programs and benefits that are only available to their members. So thanks again, for their sponsorship of this event today. So today's panel is the first time we have brought the same panelists back for a follow-up. And as most of you who have attended the previous one, seeing the panel names, you already know why. And we still have, I think, the country still has a lot of questions. We all have a lot of questions. So hopefully, some of these we can get answered today, or at least get these experts' perspective. So there is no topic more timely and high priority than the COVID, the pandemic, and the vaccine. So welcome back, Michael, Janine, and Nirmal. This is a pleasure to have all three of you back. So for the new audience members, let's start with a quick intro. So Nirmal, maybe I'll start with you, maybe give a little bit background about.
Sure. Hi, Jay. Thank you for having me. I'm Nirmal Joshi. I'm one of the chief medical officers at Mount Nittany Health in State College, and the president of the Joshi Health Foundation here in Harrisburg. Primarily, I'm an internal medicine and infectious disease physician, and then have served in various roles, both in academic medicine and in leadership positions as the clinical head of different healthcare systems in the past. So I look forward to the conversation today. Thank you.
Welcome back, and thanks.
Thank you, Jay. And I want to say hello to everyone, and thank you for having us back again. It is quite an important topic, and I want to acknowledge Dr. Joshi and Janine Peterson for the work they've been doing on the front lines. Again, my name is Mike Fiaschetti. I'm president and CEO of Mediplan Connect. We are a Medicare marketing firm involved primarily in healthcare financing, not in delivering healthcare. I was formerly president and CEO of Vibra Health Plan, which is now owned by Capital Blue Cross. And prior to that, I was president of the commercial health markets for Highmark Blue Cross Blue Shield. So I have 35 years experience in healthcare financing.
Thank you, Michael, and welcome back. Janine?
Yes, good afternoon, everyone. It's good to be back here, being invited on such an important topic. I am Janine Peterson, and I am president and CEO of Hamilton Health Center, which is a federally qualified health center located in Harrisburg. We provide medical, dental, behavioral, and social services to individuals, to families, regardless of their income or insurance status.
Thank you, Janine, and welcome back. So let's kick off the conversations with your perspective on where we are, right? So last time we left off saying, we didn't know how this is going to end, and a couple of months back the vaccine started, and then everybody was like, okay, we're getting vaccines, and so now this should be the end of it. But now we are hearing different variants from different parts of the world, and whether these vaccines will address that. So Janine, given your perspective on the community you serve, and is everybody getting the vaccines? And when they get the vaccines, are people getting fully back to what they're doing, or are they still hesitant? What's your take?
Well, I'm really pleased to inform everyone that we are getting back to some sense of normalcy. I think all of us, it's been over a year now, and we're all ready to get our lives, back in order. Vaccines here are very plentiful. It's available. There's no hesitation in terms of being able to get an appointment for the vaccine. So anyone that wants it can get it. The problem right now that we're experiencing is the hesitancy on individuals' parts that don't want it or are very suspect of the vaccine. And so we're doing a lot of education around trying to take care of the myths surrounding the vaccines, trying to encourage people to get it, because you know, we talk about herd immunity. The more of us that are immunized, the safer we will be. And so that's really been the thrust right now, is doing education out in the community. We are now mobile, so we're taking the vaccines out to the community, but certainly the variants that we've been hearing about continue to be a concern to us, but right now we feel very confident that the vaccines we have here in the United States, that concern is not significant.
So, Michael, following up on, touching on that whole education part that Janine mentioned, right? Because even at Harrisburg University, I've run into people who are saying, well, I'm not taking this right now because, I don't know if this has been tested enough, or, so what are you seeing in the community that you serve and, the people that you know, and where do you think things are as of now?
Well, Jay, again, like Janine said, I'm cautiously optimistic. Let me say that, but I do have some caution. We deal principally in the senior markets, and we have several thousand clients. And I would say, by and large, they have gotten vaccinated. However, and if you ask me for a number, I don't have an exact number, but I would say probably 80% in the senior population. But it's those 20% who are really reluctant. I've talked to clients who say, I am not getting that vaccination, but they don't really give me a good reason why. So I think we have to continue to educate, continue to find ways to incent people. And then I have, younger, colleagues and friends who have not gotten the vaccine either. So I'm a little concerned. I would have liked to seen us from a policy perspective, perhaps put some sort of number out there. So for example, we can stop wearing masks when we get 70% vaccinated. And I think we went a little fast on removing the masks without kind of more of an incentive around the vaccinations. But again, I think we're over 40% now as a population. And I'm excited about that because it will help us get back to some sense of normalcy. Although I know we're going to talk about this, I think things have changed permanently in a lot of ways in our business and in other businesses. So we'll talk about that in a little bit.
Yeah, so that's a great segue into normally the question, because you are a practicing physician. So the last time we talked, one of the things that a lot of audience took away, and even I took away, was you talked about these lingering issues with the COVID. So now with the vaccines, and you're actually seeing that, what's your take on how effective these vaccines are, and should everybody, and from an education perspective, at least the people that listen to this program live and the larger audience that will listen to it in a recorded version, for them, what can you tell them to better educate them that they should go out and take it, and the effectiveness?
Yeah, thank you, Jay. I think that I would echo, both Janine and Mike said it really well as far as the community perspective and where things are, and both absolutely true. From a medical standpoint and a public health standpoint, I think people are often, maybe we don't take it in well enough, that the fact that vaccines have been a remarkable public health advance. If you think about it, just about less than 12 months after the beginning of a massive, one of its kind ever pandemic, very aggressive, very lethal infectious disease, that in less than 12 months to have a full set of vaccines, two mRNA vaccines out there, is a remarkable public health win. So that's one. I think that perspective is very important to keep. We often look at the failings that we've had in healthcare systems across the country and across the world, but very few people realize how much of an amazing advance this is in such a short period of time. So that's one. Secondly, that these two vaccines, particularly the two that we have most available in this country, the Pfizer, those that are produced by Pfizer and Moderna, are one of the most remarkable vaccines that as even as an infectious disease person that I've seen, with efficacy rates of preventing mortality nearly 100% of the time. I can't think of almost any other vaccine that's able to do that, obviously with some exceptions. But I think that both vaccines are remarkably safe. They have what I call nuisance side effects, essentially. All of us have gone through them, and we all know what they cause. A little bit of, some soreness in the arm. Sometimes after the second dose, we are maybe down for a couple of days even, right? But big deal. At the end of it, if you can tell me that something has 100% chance of preventing me from dying from a potentially lethal infectious disease, I mean, to me, I'll go through anything to be able to get that vaccine. And so I think that people need to realize that these vaccines are remarkably, the number of people they've been tested in the very short period of time is remarkable. They're remarkably safe, and they are highly effective. Now, that being said, there are some of the hesitation that the kind of logic that I hear have to do more with what I would call biologic plausibility, which is to say, if you're sticking something into the mRNA of cells, does that potentially have a chance of, quote, messing things up? Well, the answer is no, because they not only have these vaccines, the current ones being tested in large numbers of people, but there's a long track record of mRNA vaccines that have a similar mechanism of action, much longer than the COVID-19 or the SARS-CoV-2 vaccines do. So I think that's something that people need to realize. Thirdly, what people need to realize is almost nothing in life is without potential for, could I be sure what I'm eating today does harm to me in the long term? Could I be sure a medication I'm using for hypertension doesn't come out with something 20 years later? We live with risks. But there is one risk that's imminent upon us, in front of us, that is causing people to die. And who better than, people like us who originally come from India, what we are seeing at the current time. And I know we'll talk about that more. But when you see that kind of death and suffering in loved ones, very quickly, what you realize is that in front of you, you have two options. You have a disease that's raging, right, in certain parts of the world right now, and it is far from behind us in this country, the threat of which is real, the threat is to life, and the threat is to long-term wellness or lack thereof. And on the other hand, there is this remote, hypothetical possibility that a vaccine may, and I'm stressing the word hypothetical, no evidence of that whatsoever. Now I may sound like a used car salesman. Now you can take a choice between those two.
Yeah, so that's a great point about the efficacy of it, and how the hesitancy we should look at it from a different perspective or logically. So Janine, coming back to you, because you mentioned about the education part of it, right, within the community. So what are some of the concerns people say about why they are not getting a vaccines, and how do you address that, or what are you doing from that perspective?
Oh, I think we have both a historical perspective that people have looked at, and then you have the social media, all of the myths that are out there in the, and on Facebook and other platforms. The historical perspective, especially for African Americans, is the studies years and years ago that get passed on from generation to generation of the horrific things that were done to our people, and so that has played into what I hear often as being the reason that people don't want to get the vaccines. In particular, with low-income populations who have not been treated fairly in the healthcare system, there is a distrust. So, I distrust the system because they didn't serve me well. They've, didn't give me the tests that I should have had for diagnosing a disease or my mom's disease or whatever. And so this distrust is in the system, and particularly for low income populations. And then you have, and I think it's a lot of the younger generation who go to that social media platform and they've just posted out all kinds of nonsense about the vaccines. And so we're constantly just trying to get the fact out to demyst these things out on social media. We need people like Dr. Joshi that, just what he said today in terms of the efficacy of the vaccine and the fact that, the development of that vaccine wasn't just rushed through. So we need trusted members of our community that's going to be out there, pastors, clergymen across the board. We need doctors and healthcare professionals that have served the population that we're talking about, especially in my environment. That's what's made the difference, just getting out there and repeating over and over about the efficacy and the stories about families who have been devastated by individuals dying from this terrible, terrible disease, and how it could be negated if people were immunized. So it's kind of complicated, but at the base of it, it really is very simplistic if we could get the right information into the hands of the people that's being served.
So following up on that, Michael, because you touched on this about the masks, and so when the vaccination percentage or rates is at a lower, as a business owner and as a somebody who has a large business to run, how do you make because I hear about a lot of the businesses are opening back, but then people are kind of even I'm confused. Like if I walk into Costco, I had both my vaccines, but am I supposed to wear a mask still or not? Or so as a business leader, what's the advice that you're giving to your business in reopening, and also what would you tell the other businesses out there about how to manage the next couple of months?
Yeah, and Jay, critically important that you look out for the health and safety of your employees. That's number one. I am very proud to say that all of our staff and advisors have all gotten vaccinated. We talked about it. We met as a team and we said, look, we deal with a lot of vulnerable people. We need to be vaccinated. Second of all, I have encouraged all of our team to wear a mask when they are, somewhere with our clients, because we want to protect them as well. And third of all, when clients come here or when we have various sessions or meetings or education sessions, we encourage mask wearing, and we don't sit and ask everybody if they've been vaccinated. We just encourage mask wearing. We have a tough decision to make as to whether we're going to continue that or not. At this point, we are continuing that because I'm personally not comfortable that, everybody's been vaccinated and that people that come in here, are safe. So I think on a bigger scale, now our business isn't real large in terms of the number of people, we're talking a few dozen. Very large businesses, I think, have to encourage, if not incentivize, their workforce to get vaccinated. And, when people from the outside come in, they're going to have policies that protect their employees and protect their outside constituents. It's very confusing right now in retail. Let's be honest, like you said, you don't know whether to wear a mask or not walking into these places. I think when in doubt, wear the mask. So that's kind of what we're saying at this point. I'd like to see us get closer to 70% vaccination rates before I feel comfortable dropping that policy for our organization.
Well, so that's a great follow-up to Dr. Joshi. So Nirmal, when we talk about, like when Dr. Fauci gets on the the TV and talk about, the masks and not masks, and then, all these. I mean, everybody's pretty much still confused, right? So do you, having, as a practicing physician, do you have like, a certain percentage that you think is the ideal where people can actually remove masks? Or how do you, what's the advice you give to businesses or, that has large number of people getting ready to get back on?
Yeah, no, I think I think some of the comments Mike made are very appropriate, and they reflect the somewhat of an existing uncertainty around how people, what are the foundational pieces of knowledge. We're all, people who are running businesses and so on like to see some evidence to support their decisions, right? To be able to say, yeah, this makes my whoever I'm dealing with or myself more comfortable. And Mike articulated some of those, a certain proportion of the population becoming appropriately vaccinated and so on. Unfortunately, purely scientifically based, there is no magic number above which you can say this is entirely safe. It's not. Some of the recommendations coming out of the CDC, a couple of grounding pieces of evidence that they're based on are the following. And I said this earlier, but I'll say it again only in this context to make the point. One is the remarkable efficacy of the vaccine, number one. And secondly, new data over the last, and I reviewed it a few days ago, again, in the context of vaccine, in the context of spread of the disease and therefore prevention of that spread, which is that once vaccinated, and this is relatively new information, this was different several months ago, but is becoming more and more clear that those people who've been vaccinated are also prevented from getting asymptomatic disease and therefore spreading the virus, right? So if you are vaccinated based on those two pieces of data, right, you are safe to move around wherever you feel like moving around, with some exceptions. And my area, my industry is one of those exceptions, healthcare, right? Healthcare is one of the noted exceptions from the CDC, very appropriately, because we deal with even this much of a risk to highly vulnerable immunocompromised populations is way too much. That's the logic. Other than healthcare, though, I feel comfortable, and what my take, I've been a passionate advocate of masking throughout the pandemic, because that was the sole well-described mechanism to stop transmission of the disease. And it has been proven repeatedly. Since the advent of the vaccines, and now with the new CDC guidelines, I also believe as a healthcare leader, it's imperative for me to be as a role model, to be able to say, I follow CDC guidelines. And therefore, I will be happy to walk in public without a mask. And wherever I get that opportunity to be able to, if I'm walking into a group that I know or partially know, to ask the question or to make a comment about the fact that the reason I'm not wearing a mask is because I'm vaccinated. I often try to make that point, even in small groups. If I'm meeting a group in private at the hospital, in private, not on the hallways or anything, in private, if everyone's vaccinated, we ask each other if all are vaccinated, and we discontinue our masks, because that's the correct thing to do in that setting. The setting that Michael described is more like a healthcare setting, if you think about it, right? He's dealing with his group of people, he's dealing with an elderly population, potentially immunocompromised, a certain proportion of whom may not be vaccinated. So for Mike to ask his stakeholders to wear a mask is very reasonable in that setting. It mimics a healthcare situation. So every setting is different, which is why this is so difficult to extrapolate in large groups across multiple businesses. And I wish there were more educational efforts like what we are doing today to guide the business community, to guide others to say, is this making sense based on grounding principles, or is it not making sense? Unfortunately, the pace at which this pandemic has progressed, medical knowledge and expertise takes sometimes decades. Good evidence takes decades to filter down to the masses. And we expect in a snap, today CDC says something, and tomorrow everyone in the whole country will begin to follow them. I'm sorry, it doesn't work that way. Janine deals with her set of issues. I deal with mine. Mike deals with his. And it's all of the things that Janine said about getting community leaders engaged, getting healthcare leaders like all of us to be able to speak to grounding evidence without being judgmental on people who either wear or don't wear masks, but to be able to educate them with an open-minded, but grounded in evidence every single time, the best you can. So sorry for the long-windedness of the answer, but that hopefully, also articulates some of the uncertainty around it.
Yeah, absolutely. So that touches on a follow-up to Janine. So the community, so I'm sure with it, like you said, there's a historic issues and, there's hesitancy around getting vaccine, but there are a lot of small businesses where, a couple of people or the owner may get the vaccine, but the others may be hesitant or the other way, right? And so in those, so how can you help them, or are people coming to within your community coming about with those questions? And how do you even advise in those scenarios that they can get, because for many people, the small businesses, this is their lifeline. They can't be sitting on the side. They need to get back and run their business. So what's your advice, or how do you deal with that?
Well, we are a healthcare organization. We're continuing to be masked. Mike said all of his employees have been immunized. Unfortunately, I can't sit here and say that even all of us in healthcare have been wise enough to know that they need to get immunized. We still have holdouts. We are internally talking about, and I think businesses are, trying to think through, do you require your employees to be immunized? You certainly can't have, require the public to be, but, even with small businesses or, the service industry, you have control of employees, but you don't have of the people that come to you for a service. So there's discussions about should you require employees to be immunized? Do you incentivize employees to be immunized? You heard Mike talk about incentivizing. There's some companies that have actually paid their employees to get immunized. But ours is a sort of that deeper understanding. I could offer some money to people, but that still distrust is there. And I think what I've been seeing with my workforce is, we had the first group of people when it was made available, they came through, they got immunized. I was one of the first to get immunized. My chief medical officer, one of the first to get immunized. But we're still seeing months later, trickling of our employees that they've seen, okay, well, people are still, walking around, able to function. The vaccines didn't do anything negative to them. And so we're starting to see people really say, okay, I better get immunized. And I think, the more, although CDC created, in my opinion, a lot of confusion for us, because if one day they snapped their finger and said, okay, we're going in this direction, you don't have to wear masks. And they really didn't say specifically, the media at least did not pick up, except in certain environments like healthcare. They said hospitals, but they didn't say like ambulatory care. So we've had to go back and address that. I think small businesses are starting to see, ways to make that happen as well in terms of education. We just need time to adjust, time to realize that it is safe. If we're immunized, we can walk around without a mask. It makes us feel a lot better. And I just think that with time, with education, having sessions like this, I think is extremely important. The more we can do it and talk about it, the better off we will be. And we'll start to see, hopefully getting to that 70% that Mike talked about, getting the the herd effect coming about, because we're all willing to be immunized. Now it's about children, as you know, and trying to get our children immunized in time for school. We cannot afford to have our schools continue to be, virtual. We've got to get that experience back where there's face-to-face, and having our children being able to be immunized is one clear path towards that.
Yeah, so I certainly have a follow-up around that from from a social and the countries that doesn't have enough vaccines and all of that. But I'll come back to that. But before that, Michael, so you talked about all of your employees being vaccinated and you sitting around and talking about that. But from a lot of business perspective, I keep hearing, and I talk to a lot of other CEOs, both in Washington, D.C. here and even in Silicon Valley. And we keep hearing about some CEOs worried about putting a mandate out there, is that legally allowed? And then there are others who have said, if you want to come back into the office, we are saying, you need to be vaccinated. So how did you said you're a smaller group, which probably helped, but how do you go about having this conversation where if you are a business that needs to reopen, how do you, can you force somebody, and what's your take on all of those with the employees getting vaccinated?
Well, I don't believe you can force people to get vaccinated. I think that's it's an uphill climb. Now, we work with many employer groups as well, and work with their retiring employees and so forth. And I can give you a few examples from larger business perspectives, what businesses are doing here in Pennsylvania. We operate primarily in Pennsylvania, a little bit in Maryland as well. But for example, the last employer we were working with last week, they gave everybody a personal day if they got vaccinated, so time off. So they didn't pay them, but in effect they paid them because they gave them time off. They had a picnic and had a local physician, come in and discuss the importance of the vaccination and the things that Normal said about, hey, this isn't really going to hurt you. And in fact, it's going to really protect you. So they had that level of education, continual flyers that they send out. And then if you're not vaccinated, you have to continue to wear a mask. So now this particular company had people that had to be in because they manufacture food products. So very important, that they try to get everybody vaccinated. So these are the types of things that employers are doing, but I don't know of an employer that's absolutely mandating that everybody get vaccinated. Now, we have a couple financial services companies who are saying, if you're not vaccinated, you're not coming back in the office. Although that's a whole nother topic, because I think a lot of folks are going to continue to work from home in our industry, in the financial services sector. So I think, again, that's why I talk about incentives. It's, maybe that day off. But you have to have the conversation. When we first had the conversation, we got a lot of information, and I appreciate the UPMC sent us some information. I know some people at UPMC, they sent us some information. I sat down with the team and said, here's the best information I have. My own personal opinion is an extra layer of protection is going to be critical. This technology isn't brand new. It's been out for a while. You have to let your conscience be your guide. But if it were me, I would get vaccinated. So, it was a very frank and a very personal discussion, how I felt about it. And I think that's something that you need to have with the employees. Again, you got to lead by example. You can't tell employees to get vaccinated and you don't, So I was one of the first on our team to do it. And everybody responded, accordingly.
That's great. So switching slightly into the looking at the future, right? I mean, we are like 30 minutes in, and these conversations are really interesting because we are still in the middle of it. So Normal, talking about the variants right now, so we here in US, we are talking about vaccines, the efficiency of it, and people are getting it, and we're pulling them, and then you hear about what's happening in India and other places and different variants. So when you look at beyond the vaccines, do you think this would be like flu shots every year you would have to get, or is it like every variant that pops up there would be a third shot, or whatever it is? How do you see this, and how concerned should somebody be who lives here about these variants from different countries and people coming over?
Yeah, so that's a great question, and I think a couple of thoughts. One is that remember that this is an evolving situation. So there is a lot of information that's being actively monitored and looked at by different agencies, whether it be the WHO, whether it be the CDC, and so on. So it's an actively evolving. So the comments that I make are with that caveat, right? So the existing variants, as you know, have been classified by different methods, and one of the classification types is what's called a variant of concern, right? Variant of concern means there may be a possibility that that variant spreads more easily, or maybe perhaps that some of the vaccines may have slightly less efficacy. The key word is maybe, right? Currently, though, there is no evidence among the existing variants. I will not get into the variant that's currently circulating in India, that is the most common in India, but the other variants, one that first reported from Brazil, one that was first reported from the UK, and one that was first reported from South Africa. All of those variants, there is currently, and there are studies going on with both Pfizer and Moderna, and the initial preliminary data seems to suggest that those variants, the vaccines are effective, are still clinically effective against. The one in India, there is simply not enough data, at least in the public domain, that or in published data or reported data that I know of. I'm personally genuinely concerned about it, because with these repeated waves over time, what's going on in India, and particularly despite the border restrictions, there is still movement between the two countries, right? And that always concerns me, particularly because the variant, what it's done in India is just miraculous, or very, very different compared to anything else we've seen more recently, right? So I remain quite concerned about that variant. Hopefully time will tell. The part that we don't know, though, is clearly Pfizer and Moderna vaccines are not commonly employed in India. And the two vaccines that are currently most commonly employed in India, one is an inactivated vaccine, and the other is the equivalent of the AstraZeneca vaccine, right? Both of those vaccines, particularly the inactivated vaccine, there is less information available with as it relates to the variants. Clearly, breakthrough infections with those two vaccines are phenomenally higher than breakthrough infections that have been seen among Pfizer and Moderna, right? So that's why you can't put two and two together quite yet. For a minute, leaving that aside, right? At least at the current time, it's known that the existing vaccines are highly effective, even against the commonly seen variants. That's one. The second part of your question was how long is the efficacy or the antibody protection of the vaccines? As of today, based on published information, both from Pfizer and Moderna, what we can safely say is 6 months of protection is safe, entirely highly effective. Antibody levels are protective. Clinically, there is clinical protection and so on. After that, data begins to get questionable just because of the length of time. We just haven't seen enough, right? What has been noted, though, is that although we talk about variants and mutations and so on, the degree of those mutations is nowhere near what the influenza vaccine, the influenza virus does or mutates, right? So the extent of the variability among the mutants, if it's this much in influenza virus, it's this much in COVID-19, notwithstanding the 3, 4, 5, 10, whatever number of variants are currently known. That's heartening news. What that tells us is that odds are high that the current vaccines will continue to be effective. Somewhere, this is a guesstimate among vaccinologists, this is a guesstimate that it's likely to be effective for 1 to 3 years after the first dose of vaccine, right? And odds are high that we would, it'll be effective for that length. What that might mean is a booster dose somewhere between 12 to 18 months or something to further boost the immunity so that there is longer lasting protection. But for how long, only time will tell, because it's just not enough time for clinical trials quite yet. But odds are high, if one were to predict, odds are high that there will be at least a third booster dose. And there is currently, at least there are 2 studies from Pfizer going on that are looking at that. Odds are high there will be that's looking at a booster dose, both the safety and the efficacy of it. But I think the chances are pretty real that there will be a booster time between 12 to 18 months after the first two completed set of vaccination after the first one.
So following up with Janine on what Nirmal was talking about, I also wanted to make sure if the audience have questions, as we are getting, we probably have like 10, 15 minutes before we wrap up. So please post that. So Janine, one of the questions I have with the community that you're serving and, the hesitancy, the education part, you have been working in that. Are you seeing a change in the healthcare model itself, because of the pandemic? Is there a big shift in how the healthcare delivery or the model of how you've been doing? Has it changed because of the pandemic, or are you seeing any different ideas or things that's happening in the space? And what are some of the challenges that you think is happening?
Well, certainly in the very beginning, one of the things that occurred is that we had to pivot to telehealth. Prior to COVID, we had not done any telehealth visits. But once people weren't willing to come in or were mandated not to come out of their homes, we had to find healthcare providers really had to find a way to continue to deliver care. And so telehealth became that vehicle. The challenge we had with telehealth is that a lot of the patients that we have did not have the technology readily available or in some cases, not even the understanding of how to utilize that kind of platform. The other aspect was that we have two sites that are in rural central Pennsylvania, and the broadband wasn't great in those particular communities. So there was the challenge of that, but clearly the ability to use telehealth continued to allow us to stay connected to our patients. The patients that took to it best were those in the mental health arena. They, were less anxious, not having to come out of their homes. Our behaviorists were able to really, make those connections. They didn't have to think about, well, how do I examine them like a primary care provider would, because that's the other challenge in primary care. How do you take, your blood pressure? How do you take, how do you measure the height, weight of a baby to see normal development? So in behavioral health, that wasn't needed, and that really was a factor in them being even more successful with telehealth. We're continuing to use telehealth. We're hoping, the government actually, because of the emergency declaration, we were able to get reimbursement for telehealth where we couldn't before. We're hoping that the government will continue to allow for reimbursement for telehealth services, even post-COVID. But what we have seen is a decline in the use of telehealth. Our patients still now want to come in. They are wanting a face-to-face visit as opposed to that telehealth visit. So we think certainly there'll be a hybrid. Some patients coming in still use, and some of us still using the telehealth. And that's, we have, we went from telephone use of telehealth very quickly, and then we were able to really get to video. And I think it was really more the video where our population struggled, with that. And the other aspect is we are really looking at being mobile now. So we are going out into the homes. We have mobile units now that are doing our immunizations, vaccines, and point of care. So I think we've been able to utilize this situation to the benefit of changing the model to better meet the needs of the population today as opposed to what it was in the past.
So this kind of a same question, Michael. So what are you seeing as innovation in the healthcare due to the pandemic? And do you think some of these shifts to telehealth will be long-term, or is people going to go back to the old way? Or, what are some of these changes that you're seeing?
Well, we're seeing a lot of changes, and I think a lot of it is going to be long-term, to be frank. We have a lot of older patients with chronic conditions, and they have started to adopt remote monitoring. So their physician or the nurse practitioner, whomever is monitoring them, can do it either via, the computer or by phone, or even most seniors have adopted the use of mobile technology. They all have a cell phone. So, they're more than willing to work on their cell phones to do these things. But, in addition to that, so the telemedicine, I think, is going to be here to stay, and remote monitoring of patients and a feedback loop from that monitoring. So patients can put things into their mobile phone. It comes right back to the medical records systems, and the physicians and the staff have access to that data and that information pretty quickly. So I think we're going to continue to see that. But we're even seeing things like, remote vision consultations. We had one company that just came out with a product where they will do a consultation online on Zoom or whatever, type of capability that people have, and they'll consult with them, and then they can actually right on a screen fit them up for new glasses. So, I mean, these are kind of common things, but the technology is allowing them to do that. So we've seen a number of different things like that. But I can tell you from our business perspective, we're interacting way more than I ever thought we would with seniors via mobile technology, via Zoom technology or Teams or what have you, and those types of things. And they're getting much more comfortable. It depends on the age of the senior. People over the age of 80, of course, still struggle with that type of stuff. But under that age group, pretty fast adoption of these things right now, which surprises me. I didn't think we would see that.
So that brings up the question for, as a practicing physician, as a doctor, because I always wonder, right now, the last couple of years, technology has been accelerating so fast. So everything is getting on technology, and people talk about telehealth. But as a doctor, do you have the same effectiveness? I guess this could be a controversial question depending on how your take is, but I certainly want to know, as a doctor, do you have the same effectiveness in diagnosis with these telehealth as you would see somebody in person? And how do you guide? Because sometimes the people who develop these solutions don't even talk to a doctor, or they just come up with, hey, here's a cool technology, and they're going to apply it, right? So what's your take on where telehealth is going, and
Yeah, no, I think that it never ceases to amaze me that telehealth has been around for decades, right? But I remember 28 years ago, I had gone to India, and I had taken some very simple telemedicine equipment with me to be able to test out from a remote village. And I was beaming that from what's called POTS, a plain old telephone service, from India to Penn State here. And I remember being able to do some simple things that way. And here we are 30 years later, and it's coming of age primarily because we were desperate. We had no other way to do things. And appropriately, payers began to pay for it. A lot of the technology that's currently, or that's always in place, the use is determined by if it's able to be paid for, because people are obviously very reluctant to use something that there is no reimbursement for, right? So, but back to your question, I think the vast majority of the time you can do a lot on telemedicine, particularly if you have a video visit capability. A lot can be done that way. That being said, there are certain things that absolutely lend themselves to a physical face-to-face visit. But using the simple 80-20 principle, I think a lot of the things, particularly in my realm of things, general medical care, internal medicine, cognitive disciplines, those things a lot of that can be done. Follow-up visits after a surgery, for example, just looking at a wound, a lot of that can be done on telemedicine. There are some things you simply cannot. You need the third dimension to be able to feel, to be able to dialogue, to be able to do some things in person. But what we found is that a lot can be done. and it can be done pretty effectively, almost just as well as in person. So yeah, I'm actually very excited that telemedicine has finally come of age, and a lot of things can be done that way. I'm very comfortable as a clinician to be able to see people on a video screen and be able to take care of things the vast majority of the time. In a certain proportion of patients, I'd say in my situation, about 20%, I do need to see them in person.
Yeah, I just hope that it doesn't come to a point where the physician's telling the patient how to do surgery, right? You guide them through and, here you go, cut open. I hope, that would be the scary part of the whole telehealth for me. But so coming back, we are almost like in a couple of minutes. So one last question or advice to where do you guys see the future, the post-pandemic world? What is the normal, right? What's going to be the normal after this from each of your perspective in your world, in the community that you live in, what you're seeing? What are the things that you think that has been happening during the pandemic will continue? And what are the things that you think will go back? Including so I'm starting with Janine. So like the hesitancy around the vaccine and all of these, questions around that. Would this education actually help in the next time something like this happens for people to get more on board? What are some of the things that you are seeing as the post-normal to the pandemic world?
I think that in the future, having this kind of education, I mean, we just never realized that something like this could have happened in, our communities in this country and the world. And I think that going forward, we need to be educating our workforce, our communities, even more than we ever have around prevention and education. We have not, we've walked around like no cares in the world, so to speak, here in the United States, and now we've been awakened. I think we're more conscious of needing about disinfection and hand washing and, being very diligent about where we go and how we go about doing our business. I do think that we will change the way we work. A lot of the telework has happened during COVID. We never thought many of our employees would be working from home the way they are. I think there is a business position to take on that because you can save money with that as long as you can monitor the effectiveness. So I really think that, we'll be in a better place going forward to address another issue like this coming up because it has alerted and awakened us all.
Well, thanks. So Michael, same question, right? I mean, what's the post-pandemic world look like, and what are some of the things that you are seeing?
Well, Jay, I think there's really three buckets of things that I'd like to touch on, and I'll probably repeat a little bit of some of the things Janine already said. But when I look at it from a society, a technology, and a workforce perspective, those three buckets. From a society perspective, in my business, I'm worried about the increase in the uninsured population. It has gone up, for all kinds of reasons. People lost jobs, a whole lot of issues. And I think one of the things the pandemic did from a society perspective is uncovered health disparities. We all knew they were there, but it really shined a real bright light on it. So we've got to find a way going forward to make sure that people are able to finance their care in order to get care, in order to reduce the disparities for the vulnerable populations in this country. That is absolutely critical. The second thing is technology. There is disruption all over the place in technology. And I think if businesses don't adopt that, they're fooling themselves. I mean, you look at now, it is almost commonplace now to order goods and services online, to order food online, to conduct business online. The way we do our business has changed dramatically just in the last 18 months. Our percentage of online and Zoom type business has gone up dramatically. So I think the adoption of these technologies, learning them and helping your workforce adopt them, because it's stressful for people that have been in the workforce a long time and they need to adopt that. And then finally, and Janine touched on this, and I think this is critical, is the workforce itself. People, are able to work from home. People want to work from home. People can work remotely from different areas. We've got to figure out how to be able to, first of all, invest in our people and our talent to train them to be able to do these things. But second of all, be able to get talent by allowing them to work remotely and using the technologies that are available. So I think those three things come to mind right now when I think about the future and the impacts of the pandemic on the future.
So, Nirmal, the same question, but also with a specific focus on the health, right? So pandemic is something, at least in the developed nation, it was something that was thought of as something that happens in a faraway land that you don't have to worry about. So do you think this is, there will be more of this? How do you see from the health perspective and also the overall changes in the?
Yeah, I think a couple of things. One is from a just a societal standpoint. I think a couple of things. I distinctly remember when the pandemic started in Wuhan, China, and the question of masking was beginning to come up, and how at the very early parts of the pandemic, when we would see the news, we would hear things like, what would people think in a developed nation like the United States, people going around in masks, right? And then here we are a year later. So I think the reason I say that is I think it has humbled many. We in this country live in many ways in a bubble, and we often don't realize, and I'm sure people at this table talk to their children about that all the time, about how privileged we are as a nation, how much we have, but it humbles you at the same time. And I think this pandemic was an opportunity, I think, to really, as a society, be humbled by how vulnerable we can be, right? And how we are interdependent on just about for everything. I mean, you remember the toilet paper saga back in the early parts of the pandemic, and then from there on, how much we depend on the supply chain process with different countries, how vulnerable we are as a nation. So I think it brought humility. From the healthcare perspective, it also brought perhaps a renewed, and this was just the absolute, perhaps wrong way to get there, but a renewed respect for healthcare workers in general. There had been a decline over the years. I saw that myself in my 30 years doing this in our communities. There was a clear decline in respect for what healthcare professionals do, doctors, other healthcare professionals, what they do. And there has been a tremendous increase in respect for what healthcare does. And I think particularly so in hospitals or in healthcare settings, it was heartwarming to see different members of the healthcare team shed all their preconceived notions about working together with other people, whether it be doctors, nurses, whether it be other professionals, whether it be doctors among doctors, whether it be helping each other. I can tell you I've had more heartwarming stories to share than ever before of doctors coming to me saying, sign me up for this or sign me up for that. A GYN person saying, or an ENT person saying, who was pregnant at the time, a young ENT surgeon saying, I'm willing to be on the front lines to offer care if you don't have enough people. Just these heartwarming stories, I think hit home the fact that in many ways, in my own mind, healthcare had come of age.
Well, so thanks again to the three of you, and as Janine said, one of the hopefully this is educational to a lot of people who are hesitant or want to know more about this, will go out and get the vaccines and get back to. And again, the other part, the way the three of you wrapped up the conversation was very optimistic. There is going to be a different normal, I guess, is what all of you are saying. But that normal is not something we have to fear about. It's there are a lot of good things happening. So once again, thanks for being here, and it was a pleasure having all three of you.
Thank you.